Catheter-associated urinary tract infection, CAUTI. A catheter-associated urinary tract infection, CAUTI, occurs when a patient with an indwelling urinary catheter develops a urinary tract infection, UTI. An indwelling urinary catheter is a tube inserted into the bladder through the urethra to drain urine. According to the Centers for Disease Control and Prevention, CDC, CAUTI is categorized into two types. Symptomatic CAUTI occurs in a patient with an indwelling urinary catheter who exhibits at least one of the following symptoms: fever, temperature greater than or equal to 38 degrees Celsius, 100.4 degrees Fahrenheit. Pyuria, greater than or equal to 10 white blood cells per high-power field on microscopic examination. Symptoms of urinary tract infection such as dysuria, urinary frequency, or urgency. Asymptomatic CAUTI, identified in a patient with an indwelling urinary catheter who has a positive urine culture for a uropathogen in the absence of symptoms. CAUTIs are the most common type of healthcare-associated infections, HAIs, and can lead to severe complications including sepsis, kidney damage, and mortality. Prevention strategies recommended by the CDC include limiting the use of indwelling urinary catheters to necessary cases only, removing them as soon as possible, using a septic technique during catheter insertion and maintenance, providing appropriate perineal care, and promoting adequate hydration. Prompt initiation of antibiotic treatment is crucial if a CAUTI occurs. Care bundle for urinary catheter insertion. Patient assessment. Confirm that the patient meets the clinical indications for an indwelling urinary catheter, such as urinary retention, bladder outlet obstruction, or the need for continuous bladder drainage. Equipment preparation. Gather a sterile catheter insertion kit containing a sterile catheter, gloves, drapes, antiseptic solution, and lubricant. Hand hygiene. Wash hands thoroughly with soap and water before beginning the procedure. Patient positioning. Position female patients supine with knees flexed and separated, and male patients supine with legs extended. Sterile field setup. Open the catheter kit and drape the patient with sterile sheets to establish a sterile field. Perineal cleansing. Cleanse the perineal area with an appropriate antiseptic solution, e.g., pyodine, to reduce infection risk. Catheter handling. Handle the catheter carefully without touching its sterile surface directly and lubricate the catheter tip with sterile, single-use lubricant jelly to minimize urethral trauma. Insertion technique. Gently insert the catheter into the urinary meatus until urine flows freely, avoiding force. Balloon inflation. Inflate the catheter balloon with pre-filled saline as per manufacturer instructions. Securement and documentation. Secure the Foley catheter to the patient's leg using a sterile dressing and catheter securement device. Record the insertion time and date on the drainage bag. Positioning and monitoring. Hang the drainage bag at the foot of the bed, ensuring the tubing is not kinked to maintain proper urine flow. Waste disposal. Dispose of all used materials, including the catheter and drainage bag, following healthcare waste disposal protocols. Urinary catheter care guidelines. Maintain closed drainage system. Keep the catheter and drainage bag connected continuously to prevent bacterial entry into the system. Ensure unobstructed urine flow. Prevent catheter kinks and ensure the drainage bag remains positioned below the bladder level to maintain uninterrupted urine flow. Appropriate catheter use. Insert catheters only when medically necessary, such as for patients unable to void or requiring continuous bladder drainage. Remove catheters promptly once no longer needed to minimize infection risk. Minimize catheter duration. Limit catheter use and duration, especially in high-risk populations like women, elderly patients, and those with compromised immune systems. Maintain a septic technique. Replace catheters and collecting systems using a septic technique and sterile equipment if there are breaks, disconnections, or leakage to prevent contamination. Avoid periurethral antiseptics. Refrain from using antiseptics on the periurethral area during catheter use to avoid skin irritation and infection. Routine hygiene, including daily Mayatol cleansing during bathing, is appropriate. Avoid routine changes. Change catheters and drainage bags based on clinical indications, e.g., infection, obstruction, rather than at fixed intervals to minimize manipulation and infection risk. Operative use considerations. Use catheters in surgical patients only when necessary, removing them promptly post-operation to reduce infection risk. Consider alternative catheter types. For cooperative male patients without retention or obstruction, consider external catheters as they carry a lower infection risk compared to indwelling urethral catheters. Avoid asymptomatic bacteriuria screening. Routine screening for asymptomatic bacteriuria is not recommended to prevent unnecessary antibiotic use and reduce antibiotic resistance development.